Thank you, Senator. You've helped in so many ways and been a champion for all of us. And it's great to be here with Dr. Alexander-Scott for today's announcement. And thanks for the work at the Rhode Island Department of Health, our healthcare workers, our municipal leaders, volunteers, police, fire, EMS, local organizations, our National Guard. Rhode Island is in a good place because of that leadership. And thank you for all the leadership you provided, Doctor. We're leading the nation in vaccinations. Our economy is open. Rhode Islanders are getting back to work. And this fall, our students will be fully and safely back in the classroom. Last week, in terms of economic indicators, I've been talking about the Moody's index for reopening, vacillating between 3 and 7 over the last several weeks. Number 2 in the last one. Number 2 in the entire country in terms of reopening our economy. This is something we want to hold on to, and we want to make sure it works. But at this moment, we also have the opportunity to reset Rhode Island and improve health insurance, health infrastructure, programming, and preparedness as we respond and recover from the COVID-19 pandemic. The $7 million in CDC funding that Senator Reid has secured will benefit Rhode Islanders in a meaningful way. This funding means that we will continue to have the staff to address COVID-19 pandemic, as well as prevent and address health crises in the future. There's no such thing as being too prepared. From emerging diseases to chemical and biological disasters to natural disasters, Rhode Island will be equipped with the tools we need to keep Rhode Island safe from the known and from the unknown. This also means maintaining and growing jobs in our school health care settings, in state public health jobs, and community-based organizations that address health and health disparities. I want to thank Senator Reid once again for his steadfast champion, being steadfast champion for Rhode Island. I look forward to working continually with you and Dr. Alexander-Scott to move our public health sector forward in Rhode Island. And with that, I'll turn it over to the Dr. Alexander-Scott. Thank you, Doctor.
Good morning. Thank you for those remarks. Thank you both for your leadership as well, Senator Reid and Governor McKee. It's appreciated. And in particular, and as always, thank you, Senator Reid, for your work to help bring this funding to Rhode Island to support our public health workforce. The recognition of the importance of investing in our public health infrastructure, like our state health laboratories, like what all of the work that's been done in our response to COVID, is a critical piece to ensuring that Rhode Island stays ready and we are even more prepared in advance of whatever is to come. Over the last year and a half, it has been abundantly clear to the entire country how much our economy, our educational system, and our communities overall depend on an appropriately scaled and an appropriately resourced public health infrastructure. A significant component of Rhode Island's public health infrastructure is in our state health laboratories. It is in the Cannon building that's right here. It is in our Rhode Island National Guard and law enforcement and so many of the first responders and healthcare workers across the board who have contributed to our strong response. But the public health infrastructure also is so much of what happens in the community. The majority of public health actually happens out at the community level. And investing in public health at the community level is critical because so much of what determines how healthy you are and your families are depends on where you live, where you go to school, where you work, the outcomes that are occurring at the community level. When you look at health outcomes, 80% are determined by factors at the community level. So our reopening the economy, our reopening our education and schools, job opportunities people have access to, the safety in our neighborhoods, and the access people have to healthy foods, all depend on having an adequate public health workforce infrastructure. Investing in our communities and investing in our community-based public health workforce is how we ensure that every Rhode Islander in every zip code throughout the state has access to the resources that promote healthy living in healthy communities. It's how we build a more resilient Rhode Island with a network to support all Rhode Islanders in the face of a crisis like COVID-19. This is the essence of our vision behind the Health Equity Zone initiative that Rhode Island is known for. And so much of what we do at the Rhode Island Department of Health is focused on investing in health, the expanded understanding of health, education, employment, transportation, housing at the community level. And it's why I'm so excited about this public health workforce funding opportunity. A portion of the $7 million coming to Rhode Island will sustain the critical COVID-19 response work happening at the state level and continuing into our recovery efforts. The case investigating, the contact tracing, the testing, and the future efforts to ensure our vaccination rates are as high as possible. The balance of this funding will be used to develop and support our community-based public health infrastructure in Rhode Island. For example, we'll be partnering with the Rhode Island Department of Education to support school-based health initiatives to make sure schools are ready to deal with COVID come the fall. Developing our community-based public health infrastructure also means investing in the community organizations and residents that have been doing so much over the last year and a half to make sure that all Rhode Islanders have been getting the supports they need. Leveraging health equity zones and all of our community partners, we're going to continue to develop a work plan that spells out all the details and look forward to sharing that once this plan has happened so that we can really begin to assess the outcomes that we're looking for continuing to make. In the meantime, I want to reiterate our thanks and appreciation to the governor and to Senator Reid and our federal partners for their advocacy to bring this critical funding to Rhode Island.